Hello everyone and welcome back to the channel. I'm Dr. Nancy Roy, and if you are tuning in today, chances are your big day is just around the corner or you are preparing for a beautiful new chapter in your life. First of all, a massive congratulations to you. Wedding planning is a whirlwind of emotions, dresses, jewelry, catering, and endless guest lists. But amidst all this chaotic preparation, there is one critical topic that almost every single bride-to-be leaves to the absolute last minute, or worse, avoids talking about entirely due to shyness, hesitation, or societal taboos. We are talking about intimate bridal hygiene and physical preparation for your first night and your upcoming married life. Let's be completely honest with each other right from the start. In our society, we spend months planning the perfect makeup, the perfect outfits, and the most stunning photography, but we completely ignore the health of our own bodies. Then, suddenly, right after the wedding or during the honeymoon, many young women find themselves dealing with intense pain, unexpected infections, burning sensations, and severe discomfort. Instead of enjoying some of the most memorable days of their lives, they are secretly suffering, too embarrassed to tell their partner and too shy to visit a doctor. As a medical professional, it breaks my heart to see this happen so often when it is entirely preventable. Today's video is your ultimate, complete, no-shame medical guide to bridal hygiene. We are going to strip away the awkwardness and talk about the real, practical, biological science of your body. We will cover exactly what happens to your system during intimacy, the common medical pitfalls like honeymoon cystitis, the dangers of trendy commercial hygiene products, proper hair removal timelines, and a step-by-step routine for your first night to ensure you remain completely healthy, confident, and pain-free. This is a must-watch checklist that every single bride needs to know before marriage. Grab a notebook, find a quiet space, and let's dive right into it. Scene 2. The anatomy and the ultimate medical threat. Honeymoon cystitis. Visual. Dr. Nancy leans forward slightly, switching to an informative, analytical, peer-to-peer tone. A clean, simplified, medically accurate 2D diagram appears on screen showing the proximity of the female urethra, vaginal opening, and rectum to illustrate the bacterial pathway clearly. Dr. Nancy Roy. To understand how to protect your body, we first have to understand basic female anatomy and how it reacts to sudden physical intimacy. For many women, regular or frequent sexual activity begins right after marriage. Biologically, this introduces an entirely new physical stimulus and friction to a highly sensitive ecosystem. Look at the anatomy of the female pelvic region. The urethral opening, the tiny tube through which you pass urine, is located just above the vaginal opening. And just a few centimeters below that is the rectum. Because everything is positioned so close together, it creates a high traffic zone for microscopic bacteria. When you engage in sexual intercourse, the natural physical friction acts like a mechanical pump. Any normal, harmless bacteria living on your skin or on your partner's skin can accidentally be pushed directly into your urethral opening. Once bacteria enter that short tube, they begin traveling upward into your urinary bladder. They cling to the bladder walls, multiply rapidly, and trigger an acute, painful infection. In the medical world, we call this acute urinary tract infection honeymoon cystitis. It is called that precisely because it completely catches new brides off guard during their honeymoons. Let me describe the symptoms so you can recognize them instantly. If you develop honeymoon cystitis, you will feel a sharp, agonizing, glass shard-like burning sensation every single time you try to pass urine. You will feel an intense, frantic urge to rush to the washroom every 10 minutes, but when you sit down, only a few painful drops will come out. In severe cases, your urine might look cloudy, have a strong pungent smell, or even show faint traces of blood accompanied by a heavy, aching pain in your lower abdomen. Imagine dealing with that level of physical misery while staying at a hotel or visiting a new city on your honeymoon. It completely ruins the romance and causes immense anxiety. But here is the good news. You can almost completely eliminate the risk of honeymoon cystitis by adopting one single, non-negotiable golden rule. You must urinate immediately after intimacy. Make this a lifelong habit. No matter how tired you are, no matter how comfortable you feel, within 15 to 30 minutes after sexual intercourse, get up and go to the washroom to empty your bladder. What this does is simple mechanics. The forceful stream of urine acts as a natural pressure wash, flushing out any bacteria that were pushed into the urethra before they have the chance to climb up into your bladder and multiply. After urinating, rinse the external area gently with clean plain water, pat dry completely from front to back, and drink a large glass of clean water to keep the cycle moving. This one small act will save you from a world of medical pain. Scene 3. The dangers of commercial intimate washes and the sulfate myth. Visual. Dr. Nancy holds up a generic, heavily stylized cosmetic bottle to represent commercial washes, looking directly at the camera with a serious, direct expression. Dr. Nancy Roy. Now let's tackle one of the biggest marketing traps targeting young brides today: commercial feminine hygiene washes, scented sprays, intimate wipes, and vaginal douches. If you walk into any beauty supply store or look at bridal packages online, you are bombarded with advertisements telling you that you need special strawberry scented or herbal infused washes to smell like flowers and feel clean on your wedding night. As your doctor, I am telling you to throw them straight into the trash. Do not let clever marketing cause you serious medical harm. Here is the medical reality that every woman must internalize. The vagina is a magnificent, highly sophisticated, self-cleaning organ. It does not need artificial chemicals, perfumes, or soaps to keep it clean. Internally, your vagina maintains a highly delicate, acidic environment with a pH level typically hovering between 3.5 and 4.5. This specific acidic level is your body's natural defense mechanism. It is maintained by an army of beneficial, friendly bacteria called lactobacilli. These good bacteria produce lactic acid, which acts as a protective shield, completely preventing harmful yeast and bad bacteria from growing inside you. When you take a commercial intimate wash that is packed with artificial fragrances, harsh chemical sulfates, and preservatives, and you use it down there, you are effectively setting off a chemical bomb in a delicate ecosystem. These washes strip away the natural moisture and kill off your protective lactobacilli. The moment your good bacteria die, your pH level skyrockets, becoming alkaline. What happens next? The harmful yeast and opportunistic bacteria that were kept in check suddenly take over. Within 24 to 48 hours, you develop a raging vaginal yeast infection or bacterial vaginosis (BV). Instead of feeling fresh and confident, you are hit with intense, maddening itching, redness, swelling, and a thick, curdled white discharge or a foul, fishy odor. So, how should you clean yourself? It is incredibly simple. Separate the anatomy in your mind. The internal part is the vagina, which cleans itself via natural, healthy secretions. The external part is the vulva. The vulva is the only part that needs external washing, and all it requires is plain, lukewarm water. If you feel you absolutely must use a soap because of sweat after a long day in a heavy wedding dress, use a highly gentle, completely unscented, dye-free baby soap or a certified pH-balanced, fragrance-free Sindet bar. Wash only the outside skin. Rinse thoroughly with plenty of water so no soap residue remains in the skin folds, and never, ever insert any product or water spray internally inside the vaginal canal. Less is infinitely more when it comes to intimate care. Scene 4. Anatomical wiping direction and cellular mechanics. Visual. On-screen graphic transitions to show a clear directional arrow pointing downwards/backwards, emphasizing the words front to back in bold text. Dr. Nancy breaks down the physical movement step by step. Dr. Nancy Roy. The next tip sounds basic, but you would be shocked at how many adult women perform it incorrectly simply because nobody ever explicitly taught them the correct way. We need to talk about the absolute physical direction of how you wipe yourself every single time you use the washroom or clean up after intimacy. The rule is absolute. You must always wipe from front to back, never from back to front. Let's look at the mechanical reasons why this is a strict medical rule. Your digestive tract is home to billions of bacteria, the most common being Escherichia coli, or E. coli. These bacteria are perfectly normal and healthy inside your gut and are excreted naturally through your stool. However, while E. coli is perfectly harmless in the colon, it is an absolute pathogen, a dangerous invader the moment it enters your urinary tract or your vaginal environment. If you have the habit of reaching from behind and wiping from the back toward the front, you are physically dragging millions of microscopic fecal bacteria directly from the anal zone straight onto your highly vulnerable vulva, vaginal opening, and urethral opening. It takes just a single microscopic cell of E. coli to enter the urethra to trigger a massive, painful urinary tract infection. It takes just a small colonization of these fecal bacteria in the vulva to disrupt your vaginal flora and cause severe bacterial infections. When you are a new bride, your tissues are already experiencing heightened sensitivity and micro-friction from increased intimacy. Introducing external bacteria into that sensitive environment is a recipe for an immediate medical emergency. Train yourself consciously today. Every time you use tissue paper or every time you use a water spray or hand bidet in the washroom, ensure the motion of the water or the paper always moves from the front, the pubic bone, toward the back, the anus. Never bring that hand or that tissue back forward. If you need to clean again, take a fresh piece of tissue or use a clean stream of water. This simple habit cuts down your risk of cross-contamination by nearly 90%. Scene 5. Fabric Revolution. The Breathability Criterion. Visual. A comparison layout appears on screen. On the left, images of smooth, breathable cotton fabric. On the right, shiny synthetic lace, polyester, and restrictive shapewear. Pros and cons are listed underneath each via clean typography. Dr. Nancy Roy. Let's talk about bridal fashion and trousseau planning because your underwear choices play a massive role in your physical health. When a woman gets married, she understandably buys a lot of new lingerie. Most bridal lingerie sets are made of gorgeous materials like satin, silk, polyester, heavy lace, and nylon. At the same time, to look perfectly sleek in heavy-fitted bridal lehengas, gowns, or saris, many brides wear extremely tight, restrictive synthetic shapewear for 6 to 8 hours at a time during the wedding events. While these outfits look stunning on the outside, let's look at what is happening to your skin on the inside. Synthetic fabrics like polyester, nylon, and satin are completely non-porous. They do not allow air to circulate. When you combine non-porous fabric with a tight, restrictive fit, and you sit in a warm wedding hall or travel for hours, your body naturally generates heat and sweat. Because the fabric cannot breathe, that sweat and moisture get completely trapped against your skin. This creates a highly localized microclimate, a dark, warm, humid, and oxygen-deprived environment. Do you know what thrives in that exact environment? A fungus called Candida albicans, which causes vaginal yeast infections. Yeast loves moisture and heat. If you leave your skin trapped in damp, sweaty synthetic underwear for an entire day, you are practically inviting a severe fungal infection to take hold. I am not telling you that you cannot wear beautiful bridal lingerie. Of course you can, but you need to be highly strategic about it. For your everyday wear leading up to the wedding and for your casual days after the ceremony, your underwear must be made of 100% pure, breathable cotton. Cotton is a natural fiber that actively absorbs moisture from your skin and allows air to circulate freely, keeping the area cool and dry. When it comes to your actual wedding events, go ahead and wear your specialized shapewear or lingerie for the duration of the function. But the moment the event is over and you retire to your room, do not sleep in those synthetic fabrics. Go to the washroom, clean yourself gently with plain water, dry the area completely with a soft towel, and change into a loose, comfortable, breathable pair of cotton underwear or a loose cotton nightgown without underwear to let your skin breathe and recover completely overnight. Your body will thank you for giving it that vital window to reset. Scene 6. Timing the appellation. The hair removal timeline. Visual. A clean, clear markdown style timeline. Graphic appears on screen, mapping out the days leading up to the wedding night to visually break down the safety windows for waxing, shaving, and laser procedures. Dr. Nancy Roy. Our next topic is hair removal. Almost every bride plans to remove their pubic hair before their wedding night, whether through waxing, shaving, hair removal creams, or laser treatment. However, the biggest mistake I see brides make is a massive timing error. They get their intimate grooming done just 24 hours or even the very night before the wedding. Let's look at the dermatological science of why doing this is highly risky. Laser hair removal session 7-10 days before. If you are undergoing laser treatments, your final session must be scheduled at least a week to 10 days before the wedding. This allows any residual skin swelling, redness, or heat sensitivity to fade completely before physical intimacy. Bikini waxing window. 4 to 5 days before. Waxing rips hair out violently from the roots, completely opening up your hair follicles and causing micro tears in the delicate skin. This leaves your skin inflamed and highly prone to bacterial infections. Doing this 4 to 5 days early gives the follicles time to close completely. Trimming or careful shaving 48 hours before. If you prefer shaving, do it 2 days before the event using a brand new, sterile razor and a fragrance-free shaving gel, shaving strictly in the direction of hair growth. Shaving the night before creates microscopic cuts that sting severely when exposed to sweat or friction. No matter which method you choose, never perform intimate hair removal the night before or the day of your wedding. Give your skin a minimum buffer zone of 48 to 72 hours to heal, calm down, and rebuild its natural protective barrier. If you wax or shave right before intimacy, the physical friction of intercourse combined with sweat will push bacteria straight into those open, raw hair follicles. This leads to a painful condition called folliculitis, where your entire intimate area breaks out in red, pus-filled, burning bumps that look like acne and hurt immensely when touched. Avoid that nightmare completely by planning your grooming schedule wisely well in advance. Scene 7. Systemic moisture, intracellular hydration and diet. Visual. Dr. Nancy picks up a transparent glass of water, taking a brief natural sip before continuing in a warm, encouraging tone. Dr. Nancy Roy. When we talk about hygiene, people naturally think only about external washing and cleaning. But true biological hygiene and health start from the inside out. We need to talk about your daily hydration and what you are putting into your body during the weeks leading up to your wedding. During your wedding preparations, you are running around for dress fittings, invitations, and shopping trips. You are exhausted, you are stressed, and you frequently forget to do one basic thing: drink water. Many brides survive on cups of tea, coffee, or carbonated sodas during their shopping days. This leads to a state of chronic, severe dehydration. How does dehydration impact your intimate health? When your body is starved of water, your kidneys produce highly concentrated, dark yellow, deeply acidic urine. This highly concentrated urine is packed with waste products and acts as an intense irritant to the lining of your bladder and your urethra. If your urinary tract is already irritated and inflamed from dehydration, it becomes infinitely easier for any invading bacteria to attach to the walls and cause an immediate infection. Furthermore, a dehydrated body cannot produce the natural, healthy mucosal secretions required for comfortable, pain-free physical intimacy, leading to localized tissue friction and micro tears. To protect yourself, you need to treat hydration as a fundamental medical prescription. Starting today, you must drink a minimum of 2.5 to 3 liters of pure, clean water every single day. Keep a reusable water bottle with you at all times. In addition to water, make structural adjustments to your diet. Incorporate a bowl of fresh, unsweetened, natural yogurt or curd into your daily meals. Yogurt is packed with live, natural probiotics, specifically our friendly lactobacilli bacteria. By consuming natural probiotics, you are actively reinforcing your body's internal defenses, helping your gut and your vaginal ecosystem maintain their ideal acidic pH balance naturally. Avoid excessive intake of highly sugary sweets, desserts, and processed junk food during this time because high sugar levels in your bloodstream can actually alter the sweat and glucose levels in your skin folds, actively promoting the overgrowth of fungal yeast. Scene 8. The step-by-step first night emergency plan. Visual. The screen layout transitions into a scannable, highly organized procedural format with a subtle header text reading Medical Action Plan for the First Night. Dr. Nancy Roy. To wrap everything we've learned into a clear, stress-free routine, let's walk through a definitive, step-by-step physical hygiene routine for your actual wedding night. This is a practical, medically sound sequence designed to keep you completely safe, comfortable, and confident. 1. The pre-intimacy freshness. Reset before bed. Before you lie down, excuse yourself to the washroom. Take off your heavy wedding attire and jewelry. Use clean, lukewarm water to gently rinse away the sweat and makeup accumulation from the day. Pat yourself completely dry with a fresh, clean towel. This removes the daytime bacterial buildup and instantly boosts your personal confidence. 2. The immediate post-intimacy flush within 15-30 minutes. The moment intimacy is over, do not just fall asleep. Within 20 minutes, go to the washroom and empty your bladder fully. This step is mandatory to mechanically flush out any skin bacteria that entered your urethra before they can colonize your bladder. 3. The gentle external cleanse. Post-intimacy wash. Use a handheld bidet spray or plain water to gently rinse the external vulva area. Remember our rule: wipe or wash strictly from front to back. Do not use any scented soaps or intimate washes at this moment, as your tissues are highly sensitive and will react with irritation. 4. The complete drying phase. Moisture elimination. Take a dry, clean, soft tissue or a clean cotton towel and gently pat the skin completely dry. Do not rub harshly. Leaving the area damp before putting on clothing creates a humid trap for fungal yeast. 5. The breathable fabric. Reset. Overnight recovery. Slip into a loose, fresh pair of 100% cotton underwear and a breathable nightgown. This allows your skin to cool down, prevents sweat accumulation, and gives your body the perfect environment to recover overnight. Scene 9. The Wedding Emergency Medical Kit. Visual. A clean, well-organized table layout appears on screen detailing exactly what a bride should pack in her medical travel pouch for emergency protection. Dr. Nancy Roy. My final piece of advice for you is to put together a small, dedicated bridal medical emergency kit that stays in your personal handbag or your honeymoon suitcase. When you travel or transition to a new home, you might not have immediate access to a pharmacy or a trusted doctor. Being prepared beforehand prevents minor issues from turning into major panic. Here is exactly what your medical kit should contain. Emergency item medical purpose and protocol cranberry extract tablets taken daily. High-quality cranberry extract prevents bacteria from sticking to your bladder walls, acting as an excellent natural defense against early UTI symptoms. Fragrance-free, baby wipes, water-based, alcohol-free, unscented wipes for quick cleaning when traveling or when a proper washroom shower is unavailable. Over-the-counter, pain relievers, standard ibuprofen or paracetamol to manage sudden menstrual cramps, pelvic soreness, or tension headaches during hectic travel. A prescribed emergency antibiotic. Visit your trusted doctor before the wedding, explain you are getting married, and ask for a standby, one-dose or short-course antibiotic specifically for UT is to pack in your suitcase just in case. Scene 10. Conclusion and normalizing the conversation. Visual. The camera pulls back into a warm, supportive close-up of Dr. Nancy Roy. Her tone is deeply encouraging, friendly, and empowering. Dr. Nancy Roy. Dear brides, please remember, physical intimacy is a beautiful, natural, and healthy part of marriage. It should never be associated with fear, shame, or physical pain. By taking ownership of your health, understanding how your body operates, and following these basic, scientific hygiene steps, you can step into your new life with absolute confidence, radiant health, and complete peace of mind. Do not let outdated taboos keep you from protecting your well-being. Share this video with your close friends who are getting married or any bride-to-be who needs to hear this advice today. If you found these medical tips helpful, please hit that like button, subscribe to the channel for more straightforward women's health guides, and feel free to drop any questions you have in the comments below. I read them and am always here to support you. Have an absolutely magical wedding day, take beautiful care of your bodies, and I will see you all in the next video. Bye-bye.